Have you ever felt like your feet are burning as if they were on fire, especially at night, just when you lie down? It's not normal fatigue, it's not just heat, and it's not something you should ignore, because that burning sensation in your feet may be a sign that something deeper is happening in your body. Something related to nerves, circulation, metabolism, or even diseases that progress silently. Stay with me, because understanding why your feet burn could help you avoid much more serious problems in the future. Before we continue, subscribe to the channel now and turn on notifications. Here we talk about health in a clear, approachable way with useful information for your everyday life. Now then, let's begin. I want to talk to you calmly, the way I would with a patient or a friend. The sensation of burning, heat, tingling, or numbness in the feet is one of those symptoms many people tend to downplay. Sometimes it's uncomfortable, sometimes it hurts, and other times it simply doesn't let you sleep. The problem is that, although in some cases it's not a big deal, in others it can be an early sign of something more serious. Today I'm going to explain step by step the most common causes of burning feet when you should be concerned, and what you can do to relieve it and treat it properly. Why does it usually get worse at night? Many people notice that the burning in their feet appears or intensifies at the end of the day or during the night. This happens for several reasons. During the day, your feet handle weight, pressure, and effort. At night, when you relax, the nervous system makes more noise, and discomfort is perceived more intensely. In addition, when you lie down, circulation changes, and certain nerve or blood vessel problems become more noticeable. Cause 1. Overuse and fatigue. Let's start with the simplest explanation. If you spend many hours standing, walk a lot, run, work on your feet, or wear inappropriate footwear, your feet may end the day irritated and overloaded. In these cases, the burning sensation is usually, at the end of the day, bilateral accompanied by fatigue. The solution here is usually simple. Rest with your feet elevated, lukewarm or cool water baths, and a gentle massage with moisturizing cream. Cause 2. Skin problems. Sometimes the problem isn't inside, but in the skin. Friction, irritation, wounds, fungal infections, or what's known as athlete's foot can cause burning, itching, and stinging. Here, the important thing is to look at your feet, examine the skin, and treat the specific cause. Anti-fungal creams if there's fungus, soothing or corticosteroid creams if there's irritation, proper wound care. Cause 3. Nerve involvement, neuropathy. This is one of the most common causes when the burning is persistent. The nerves that reach the feet can be damaged for multiple reasons. When this happens, sensations such as burning, tingling, stabbing pain, or numbness appear. This is where very important causes come in. Diabetes and burning feet. Diabetes is probably the most common cause of chronic burning in the feet. So-called diabetic neuropathy progressively damages the nerves, especially in the feet and legs. That's why properly controlling blood sugar isn't just about sugar, it's about protecting your nerves and your quality of life. Alcohol and nerves. Prolonged and excessive alcohol consumption can also damage nerves. Even without episodes of drunkenness, alcohol can cause alcoholic neuropathy, which often begins precisely in the feet and legs. Burning, tingling, and numbness may be the first signs. Vitamin deficiencies. B vitamins are essential for nerve health. Deficiencies in B12, folic acid, B1, or B6 can cause burning in the feet. This may be due to poor nutrition, intestinal problems, digestive surgeries, alcoholism. Vitamin D does not directly cause burning, but severe deficiency can weaken bones and promote painful microfractures. Arterial circulation problems. When arteries narrow due to cholesterol plaques, blood doesn't reach the feet properly. At first, burning appears, then pain when walking, and in advanced stages, changes in color and temperature. A typical sign is intermittent claudication, intense leg pain when walking that forces you to stop. This should always be evaluated by a doctor. Varicose veins and venous problems. Varicose veins make it difficult for blood to return to the heart. This causes heaviness, fatigue, itching, and sometimes burning in the feet and legs, especially at the end of the day. If this content is helping you, subscribe now. Let's continue. Thyroid, kidney, and other internal causes. Hypothyroidism can cause swelling that compresses nerves. Chronic kidney disease can lead to fluid and toxin buildup that affects the nerves. Both can manifest as burning in the feet. Toxins and heavy metals. Exposure to mercury, lead, or arsenic can cause neuropathies. Mercury, for example, can be found in large fish such as shark or swordfish. Medications. Some medications can cause burning in the feet, especially at the beginning. Chemotherapy, certain antibiotics. Statins, neurological drugs. Symptoms usually improve after stopping the medication, but this should always be evaluated by a professional. Orthopedic causes. Here we include very common problems: sciatica tarsal tunnel syndrome, plantar fasciitis. They may begin with burning in progress to more intense pain. Other less common causes: anxiety, fibromyalgia, infections, gout, neurological diseases, and rare disorders such as erythromelalgia can also cause this sensation. Treatment. What to do? There isn't a single treatment. It all depends on the cause. From rest and local care to disease control, medication adjustments, physical therapy, or specific treatments. What's important is not to treat only the symptom without knowing the origin. Home remedies with caution. Lukewarm or cool water baths, gentle massages, and certain creams may provide relief. But be careful. Relieving is not curing. Never replace a medical evaluation if the problem persists. When should you really worry? I want you to be very clear about this. Not every burning sensation in the feet means a serious disease, but there are signs you should never ignore. For example, if the burning appears progressively and does not improve with rest, if each night it becomes more intense, if it is accompanied by loss of sensation, weakness, or changes in skin color. At that point, your body is asking for help. It's especially important to pay attention if you have diabetes, a history of circulation problems, regular alcohol consumption, or if you take medication chronically. Another key point is symmetry. If the burning affects both feet in a similar way, it usually points more toward a metabolic or neurological problem. If it appears in only one foot, there may be nerve compression, a localized vascular problem, or an orthopedic cause. And pay attention to pain when walking. If while walking you notice the burning turns into intense pain and forces you to stop, that is not normal and should be studied as soon as possible. Many people normalize these symptoms for months or even years. They get used to them. They tolerate them. And when they finally seek medical advice, the problem is already advanced. That's why this message is so important. Listening to these signals in time can prevent serious complications, from irreversible nerve damage to severe vascular problems. The good news is that, in most cases, when detected early, there is a solution or at least significant room for improvement. So it's not about living in fear, it's about living with awareness. Your body speaks, your feet do too, and learning to listen to them is one of the best decisions you can make for your long-term health. Burning feet are not a trivial symptom. Sometimes it's fatigue. Other times it's a warning sign. Listening to your body is a way of taking care of yourself. If this video has helped you better understand what's happening, share it. It could help many people. Subscribe to the channel and turn on notifications for more clear and useful health content. Thank you for being here. Take good care of yourself, and I'll see you in the next video.